Now, let's go to another chapter, gunshot wounds. So under this topic, we will be talking about the determination of presence of gunpowder and primer components. We will also discuss about the importance of determining the gunpowder on the skin of the victim, procedures in determining the presence of gunpowder, test for the presence of powder residues, test for the presence of primer components. We will also be discussing about firearm identification. The factors utilized in the identification of the firearm used in the commission of the crime, basic principles involved in firearm identification, instruments used in firearm identification, types of marking on the examination through the comparison microscopes. In firearm identification, the examiner must take into considerations the following: gunshot wounds in different parts of the body, like the head and neck, the cranium, brain substance, face, neck, the chest, abdomen, spinal cord and spine, and the extremities. Now, determination of presence of gunpowder and primer components. Let's discuss deeper. Importance of determining the gunpowder on the skin of the victim. Determination of the distance of the gun muzzle from the victim's body when fired. The explosion of the powder in the cartridge expels particles which may be embedded in the skin or just clinging on the surface at a distance of not more than 24 inches. Less powder particles at the wound of entrance is observed in smokeless powder as compared with black powder. Distribution of gunpowder is more in the upper portion of the wound of entrance. Okay? These are just matters of reading, guys. Okay? Always refer to your book. So, presence of gunpowder at or near the wound of entrance, gunpowder muzzle fired not more than 24 inches. So, this is the image as you can see in the pattern. So, if the closer the object, so at the left side you can see the mark. Okay? As it goes farther, as you can see, it expels residues. Okay? The farther it is, the more residues it expels. Unlike if the object is near, it is more concentrated. Okay? Distance plays a role in the firing of a gun. Determining whether a person has fired a firearm. When a person fires a gun, the powder particles which escape may cling on the dorsum of the hand. So, as you can see in the picture, okay, the highlighted part is where the gun residue will cling. Okay? Basics of the test. When a gun is discharged, two types of residues are liberated: forward towards target and also backward towards the shooter. Okay? Metallic residues which comes from primer. Particles of burned, burning, and unburned gunpowder which comes from the propellant. So if there is presence of these particles on the palm of the hand, then that individual has fired a firearm. Okay? So, if a person fires a firearm, this residue will cling to the hand of that individual. Okay? That's why a police officer or the medical juries will conduct investigation. Okay? Will conduct tests in order to know if that person fired a gun. Procedures in determining the presence of gunpowder. Gross examination or examination with the use of hand lens. This is not conclusive because other foreign particles may be mistaken as gunpowder or primer components. Okay? Mere inspection is not a conclusive test, but nonetheless, it is part of the test. Particles are mainly found on region of gunshot wound, of entrance, on dorsum of the hand, wearing of the victim. Okay? Gunpowder. It is the fine black powder particles of varying sizes. Microscopic examination, another test in determining gunpowder residue. Fine particles may be magnified, but there are no characteristic shape, color, or consistency of gunpowder. Chemical test. Burning, tattooing, and smudging visible through the naked eye. And then distance of the gun muzzle to the skin. So, the burning and tattooing will gradually disappears as the muzzle distance increases and vice versa. Minute particles of burning and unburned residues and primer constituents can be detected in the laboratory. So, this is the illustration. The farther the distance, the smaller the residue. Okay? Compared to the short distance, the residue is more concentrated. Test for the presence of powder residues on the skin, dorsum of the hand, or site of the wound of entrance. The dermal nitrate test, paraffin test, diphenyl amine test, lungs test, or Gonzalez's test. The dorsum of the hand and fingers up to the region of the wrist is coated with melted paraffin, heated at temperature of 150 degrees Fahrenheit. Okay? The hand of the person suspected of firing a gun will be submerged in a melted paraffin. The melted paraffin penetrates the minute crevices of the skin, and when hardened and cooled off, some of the powder particles will be extracted and embedded in paraffin cast. Okay? After the cast is formed and solidified, it is removed from the hand or from the site of the wound of entrance, and the inner aspect of the cast is treated with lungs reagent. Okay? A reagent is placed. So the result, if the test is positive, then due to the presence of small particles containing either nitrate or nitrite, will cause a blue reaction of the particles upon contact with lungs reagent. Okay? As you can see in the image, there is a reaction turning the cast into blue. Okay? However, this test is not conclusive as to the presence of gunpowder because fertilizers, cigarettes, cosmetics, urine, and other nitrogenous compounds will give a positive result. Okay? So, this test will neither deny nor confirm the presence of gunpowder. Okay? Because other materials that contains nitrogenous compound will give a positive result. A negative test is also not conclusive that the person didn't fire a gun from a well-constructed handgun, will not discharge any residue on the hand, or the hand might have been subjected to extensive washing. Next, on clothing, especially colored ones, we utilize Walker's test. It used C-acid test, H-acid test. A glossy photographic paper is fixed thoroughly in hyposolution for 20 minutes to remove all the silver salts, and then washed for 45 minutes and then dried. The dried photographic paper may be treated with any of the following: warm 5% solution of 2-naphthamine 4 to 8 disulfonic acid for 10 minutes and then dry. Warm 5% solution of 1-amino 8-naphthol 3 6 disulfonic acid for 10 minutes and then dry. Warm 0.5% solution of sulfonylate acid for 2 minutes, dry, and then swab with a 0.5% solution of alpha naphthamine in methyl alcohol and then dry. The sheet of the prepared paper is placed face up on a towel or pad of cotton, and the material to be tested is placed on top, face down on the paper. The preparation is then covered with a thin dry cloth or towel slightly moistened with 20% solution of acetic acid and another layer of dry cloth. The entire pack is pressed with a hot iron for 2 minutes. The paper is removed, washed with hot water and methyl alcohol to remove excess reagent and then dried. Okay? These are the procedure. These are just matters of reading. Okay? Refer to your. The result. If unburned particles are present, it will result to the production of dark red or orange-brown spots on the prepared paper. So, this is the result, okay? If unburned particles are present. Okay, another test for the presence of primer components. The Harrison and Gilroy's test, okay? By the use of cotton swab dipped in reagents, okay? These are the reagents. Please refer to your book. And then the cloth is then dipped into various reagents, okay? The reagents are sodium rhyodinoate, if color red, presence of another elements. So, does not use for forensic laboratory because inadequately sensitive and low specificity to the color reaction. And there is also instability of colors, okay? This is just other tests performed to determine presence of primer component. Neutron activation analysis. Sample obtained from hands washed with dilute acid. First, the hand is exposed to radiation which emits neutron. Second, the material is being exposed to the radiation. Result by making appropriate counts at different energy levels. The elemental traces has been found. Okay? This is the procedure. So, extremely sensitive and can detect very small quantity. Expensive, unable to detect certain elements and required access to a nuclear reactor. Principle, presence of elements converted to their isotopes by neutron bombardment after that quantity is measured. Okay? Just a matter of reading. So, this is the principle involved of NAA. Okay? Just study the illustration. Flameless atomic absorption spectroscopy or FAAS. This is another test. In this test, hand washing is done at high temperature to vaporize the elemental traces and then collected by the absorption spectroscopy. This method is used in modern science crime laboratory. Can detect elemental traces of certain elements. Another test is the use of scanning electron microscope with a link X-ray analyzer. In this method, any sticky material is used to collect the residue particles. The material is then examined under the scanning electron microscope with an X-ray analyzer. The results would be particles is being recognized through their shape and size and can distinguish from other materials. And the X-ray analyzer confirm their identification. more specific than other three methods, and is seldom been used in the laboratory. Okay? So, this is an example at the right side. More scientific. Firearm identifications. Now, let's move on to another topic. Factors utilized in identification of firearm. 1. Caliber of weapon. A firearm may be identified from its caliber, from shell, bullet, cartridge, or the character of wound. Okay? It's like a fingerprint also in humans. The caliber is unique for every firearm. Okay? The shell, the bullet. Okay? Principles of firearms identification, caliber designation. Okay? As you can see in the diagram, it is the cross section of a barrel, okay, that forms the rifle. So caliber relates to nominal inside dimensions of the barrel, okay. There is a .22 caliber and so on and so forth, okay. Just review the diagram. Fingerprints. Fingerprints may be found in the butt of the firearm or at the trigger and its guard. The fingerprint found at the butt may distinguish homicidal or suicidal nature, okay, as to its handling, okay. Fouling of the barrel. The firearm which is recently fired, may have a characteristic odor of the smoke inside the barrel. Chemical analysis of the barrel will show whether the weapon was recently fired. Serial number. All firearms bear serial numbers for their identification. Okay? It's like their birth certificate. Procedure of restoring serial number if tampered. A. Cleaning. Site of number carefully cleaned, removing all dirt, grease, oil, and paint with gasoline, xylol, and acetone. Okay? Because usually, guns used in crimes are tampered. That's why this is a procedure on how to restore tampered serial numbers. Polishing. Whole surface should be smoothly polished using fine file followed by a medium to fine grade carborundum cloth. The time of polishing depends on hardness of granularity of the metal. They should always have the mirror-like surface. Let's go now to etching. For all iron and steel materials, the following solution may be used. Hydrochloric acid, 80 cc. Distilled water, 60 cc. Ethyl alcohol, 50 cc. Copper chloride, 10 cc. The solution is swabbed on continuously until the numbers appear. Okay? These are for iron and steel materials. Okay? In order to restore tampered serial numbers. Ballistics examination. It is the study of physical forces reacting on projectiles or missiles. Forensic ballistics, conventionally known as firearm identification. Interior ballistics or internal ballistics. It is a branch which deals with what happened to the cartridge and bullet from the time the trigger of the gun is pulled until the bullet exits from the barrel. Okay? So, that's that span of time where after pulling the trigger and exiting on the barrel, that is called internal ballistics. Exterior ballistics or external ballistics. It deals with the bullet the moment it leaves the gun barrel to the moment of impact on the target object. Okay, this is an illustration of gun examination. Okay? So, if you have questions, feel free to message me. And please always refer to your book for any further readings. Terminal ballistics. It concerns with the effect of bullet on the target. Medical ballistics. A form of terminal ballistics wherein the target is a person. It is concerned with the penetration, severity, and appearance of the wound due to bullet or missile. So these are just matters of reading. These are definitions of terms, okay? Now, let's go to the basic principles involved in firearm identification, okay? There are many questions that come up in firearms investigations. The two that comes up most frequently are, first, what kind of a gun was used? And second, was this particular gun used? So these are the questions that would arise, okay? Firearm characteristics includes the number of lands and grooves, the direction of the twist, width of the individual land or grooves, etc., which become the basis of class characteristics in firearm identification. Okay. No two firearms can be manufactured with identical surface characteristics. Okay, that's the rule. It's like fingerprints. Each firearm will show the difference. Marks on the different bullets or shells fired from one firearm have similar characteristics when viewed in the comparison microscope. And then, marks on different bullets or shells fired from the different firearms will show variation in the findings. Instruments used in firearm identification. So, these are the devices used, the gadgets. Comparison microscope. Instruments consist of two compound microscopes, allows comparison of two objects by looking through a single eyepiece. When two objects are compared, the individual or accidental characteristics may be compared. Bullet recovery box. So, as you can see in the picture, that's the diagram of a bullet recovery box. It is a device used for the purpose of recovering the test bullet and shell. In the NBI, it is long cylindrical container filled with cotton and an open shooting end. The suspected firearm is fired and the bullet may be recovered in the layers of the cotton, and the shell may be found in the area where it is fired. Other ways of recovering test bullets are: shot may be fired on a box with oil and sawdust. Okay? So, you make a box and then placed oil and sawdust. Vertical or horizontal shot on a water tank. Okay? Shot fired on a block of ice. Okay? These are other ways of collecting bullets. Types of marking on the examination through the comparison microscope. Impression type mark or stamp mark. This is the forcible application of a hard surface against a softer one, leaving an impression on the harder surface. Example, the striking of the firing pin on the percussion cap. Next, the impact of the base of the cartridge on the breech block of the gun. Okay? Striations or serration mark. These are produced by a harder surface scraping, dragging, sliding, or slipping across a softer one, leaving a series of abrasions, serrations, and scrapes. Okay? Example, the ejector may cause striation markings on the cartridge case in the process of ejection of the spent shell. Okay? Upon firing, it leaves a striation mark. Okay? As can be seen in the image. It's a little bit blurry, but there are striation marks left after ejection of the shell. When a cartridge is fired from a firearm, the following marks may be found in the shell and from the bullet. Marks found in the shell. Marks of the firing pin. The firing pin leaves impressions in the percussion cap. The depth, location, and the size may be individual characteristics of a firearm, okay, as illustrated in this picture. Marks from the extractor. The extractor mark is found in front of the rim of the shell. The scratch impressed by the extractor is a characteristic in a particular firearm. Marks of the ejector. This mark is found at the head of the shell. Generally, the ejector mark has a position opposite the extractor mark, although it is not always the case, okay, as as illustrated in the diagram, okay. These are just matters of reading, guys. Marks from the breech block. The impact of the shell to the breech block in the recoil impresses the ridges of the breech block and often gives identification marks characteristic of a firearm. And then marks on the cylindrical surface of the shell. The marks are brought about by the surface of the firing chamber or by the magazine, okay? As you can see in the illustration, the green arrows are pointing to parallel breech block marks, okay? And the center, the red one, is the firing pin mark, okay? Marks found in the bullet. Number of lands and grooves. The number of grooves, depth, and width depend upon the manufacturer of the firearm. Direction of the twist of the rifling marks. The direction of the spiral lands and grooves may be a twist to the right or to the left. So, this is a summary of markings on cartridge cases. Okay? Just examine the illustration. So, you can see the chamber marks when this bullet was fired. And then the extractor mark. Okay? The ejector mark at the bottom. And at the top right, the ejection port mark. Okay? Just examine this bullet. In the firearm identification, the examiner must take into consideration the following: gross examination or examination with the use of magnifying lens. Caliber of the bullet. This may be determined by simple inspection by an experienced examiner. Weighing of the bullet. Determining the diameter of the bullet by the use of a caliper. And then check for presence or absence of deformity or loss of part. And then presence of foreign elements like blood, flesh, connective tissue, soil, etc. And then identifying marks placed by previous possessor. Examination with the use of comparison microscope. So this is a comparison between evidence shell or bullet with a test shell or bullet, okay? So there is the actual shell or bullet that was used by the perpetrator, and then a controlled shell or bullet for comparison. So determination of the class characteristics. Physical characteristics of a certain caliber of firearm used by the manufacturer. First, number of rifling. Second, direction and rate of the rifling marks. Third, dimension of the lands and grooves. Fourth, the depth of the grooves. And fifth, style of the cannelure. Determination of individual or accidental characteristics. Okay? Like rifling of the barrel, firing pin mark, breech block mark, extractor mark, and ejector mark. So, as an examiner, you must take note of all the characteristic, okay? Study the bullet, study the shells in its entirety. Okay, every mark counts. Now, let's go to another topic. Gunshot wounds in different parts of the body. Head and neck, the cranium. So, close or near contact, fire in the head. The marked laceration of the skin, burning and tattooing surrounding the skin. The skull fractured without any definite shape with linear extension. Okay? The fire from a distance with a bullet having right angle that approach to the skull. Radiating linear fracture from the point of entrance and exit of the wound will be clean, cut, oval, or rounded opening. Okay? Just a matter of reading. Then, grazing approach of the bullet produced an elongated gutter like depressed fracture of the cranium. The tangential impact of the bullet caused it to split, and it's not uncommon to see a fragment lodging in the brain substance. So, here's an illustration, okay? The first picture shows entry of the bullet, the linear fracture, okay? And then the second picture, the exit of the bullet, okay? Then, it is fired from a distance with the bullet having right angle that approach to the skull, okay? The other picture at the right shows close or near contact fire in the head. Now, let's go to brain substance. Bullet wound in the brain substance is usually rugged tunnel with a diameter larger than that of the caliber of the bullet, with marked ecchymosis of the surrounding area and filled with fresh and clotted blood. So, as shown in the illustration below. Fragments of bones may be felt in the tunneled bullet tract. Injury of the cerebral hemispheres is, as a rule, not immediately fatal, and the victim may survive the injury. However, a bullet course which includes the medulla, pons, and other vital centers causes immediate death. Some victims may live for some time but may develop epileptiform convulsions, as shown in this figure, okay? Using serial electroencephalography, okay? Now, let's go to the face. Firearm wound on the face may not cause serious trouble except that it becomes a potential venue of infection and may cause marked deformity. Okay? And then the neck. The bullet may pierce the front portion of the neck, involve the cervical portions of the spinal cord, thus causing instantaneous death if the upper portion is involved. The carotid or jugular vessels. Death may be due to profuse hemorrhage, okay? Because it is rich in blood. The anterior wall of the esophagus may be perforated and the bullet may enter into the gastrointestinal tract and expelled through the bowel. Next, injury to the trachea and upper bronchi may cause asphyxia or aspiration pneumonia. Okay, here are some illustration. Okay, cervical injury due to gunshot. And then below, aspiration pneumonia due to gunshot wound on the neck. Okay. Chest. The chest wall. The bullet wound on the chest wall usually has an upward course and may involve both sides. The bullet may strike the rib, sternum, or the body of the vertebra and may cause deformity or deflection of its course. when the intercostal or mammary vessels are injured, there will be profuse hemorrhage. Okay? Here's an illustration. A sample of gunshot wound on the chest. It is caused by penetration of the bullet, which travels through a projectile path after being shot from a firearm. The bullet, on hitting the chest, punctures the tissue it first encounters with, the bones or the muscular chest wall. Okay? Then the lungs. The passage of a bullet in the lungs produces a cylindrical tunnel. When the pulmonary vessels are involved, profuse hemorrhage is observed, which produces death before medical or surgical intervention can be instituted. If only one lung is involved, the profuse hemorrhage may cause collapse of the lungs, displacement of the heart, and mediastinum towards the uninjured side. Okay? Involvement of the bigger bronchi may cause asphyxia with the lung, partially atelectic and emphysematous. The victim may not die immediately, but later may develop aspiration pneumonia or cerebral embolism. Okay? Depending on the body parts which the bullet penetrates, okay, it has after effects. Even though some are not dangerous, but because of infection, it can cause death. So this is another illustration of a gunshot wound. Cylindrical tunnel, entry of bullet, okay? And then collapsed lungs, pneumothorax, because of the injury. The heart. Bullet wound of the heart may be circular or stellate with subepicardial hemorrhage in the surrounding tissue, okay, upon injury. The course may be of any direction, but the right ventricle is often involved because of the large surface area of exposure in front. Wound of the auricle is more rapidly fatal as compared with the wound of the ventricle on account of thickness of the musculature of the latter, which produces temporary closure of the wound. Now, here's an illustration of a cardiac tamponade. Okay? Death in firearm wound of the heart may be due to the loss of blood or tamponade. The abdomen. Wounds are quite frequent but not as chest or head wounds. Bullet wounds of the liver and parenchymatous abdominal organs may cause stellate perforations which are larger than caliber of the bullets. Bullet wounds in stomach and other hollow areas are small on account. Death due to peritonitis is not rare on the account of the spilling of its contents into abdominal cavity. So this is an illustration of a gunshot wound on the liver. It forms a stellate form. Okay? Spine and spinal cord. Injury of the spine may not involve spinal cord, but injury of the spinal cord due to bullet affecting canal, and it can cause partial or complete severance. Injury in the body or other parts of the vertebra, and contusion, concussion, or compression on account of impact. Injury of the upper cervical spine can cause death because of vital nerve tract involved. Lower spinal cord injury may cause motor or sensory paralysis. Okay? As you can see in the illustration at the side, there's a gunshot in the middle of the spine. Extremities. It may show the characteristic lesion of gunshot wounds. Usually, the wound is not serious except when it involves the principal blood vessels and nerves. The bony tissue may involve producing comminuted fracture of the bone and deflection of the course of the bullet. Okay? Here in the illustration, you can see a comminuted fracture due to gunshot injury. Now, that ends our discussion of gunshot wounds. And like I've said before, these are just matters of reading, guys. Okay? Please refer to your book because mostly our discussions revolve around definition of terms, basic principles, enumerations. Okay? So, always refer to your book. Okay? So, thank you and God bless us all.